Dealing with complications from IV insertion requires a systematic and patient-centered approach. Let's discuss them step by step. We should bear in mind that before attempting an IV insertion, it is crucial to assess and evaluate the patient's vein. That is, you check the vein if it is the right one to use before attempting it. Also select the right equipment. You select the right cannula, the right size and type for the patient's vein. So now you will explain the procedure to the patient and ensure that the patient is comfortable. You know, the needle prick can be very uncomfortable for some patients, while others can also endure. So you make sure your patient for this procedure is being made comfortable before you go on with the procedure. You do this by offering emotional support, or what we call preparing the patient's mind towards the procedure. Now, what are some of the complications that we encounter following an IV insertion? The most common and the first of them all is difficulty locating a vein. What do we do when this happens? Normally, you have to employ trans-illumination, vein visualization technique, and also vein palpation. When you employ these techniques, you will be able to get the right vein for the right purpose. You also try different angles by adjusting the angle of the needle to better align with the vein. Another complication is vein collapse or blow. When this happens, what are you supposed to do? You immediately withdraw the needle to prevent further damage. You apply a gentle pressure to the affected area to stop any bleeding, and then you try an alternative vein for the IV insertion. Hematoma formation is another complication. When it happens, you also do the same. You remove the needle immediately, and then you apply a firm pressure on the affected area to prevent further bleeding. And then you keep a close eye on the patient. You keep an eye on the patient and look for signs of infection, such as swelling, increased pain, or redness. Another complication is nerve damage. When this happens, you stop the procedure immediately. You stop the whole IV insertion procedure immediately, and then you evaluate the patient's nerve function and sensation. Then you seek medical attention, that is consulting with a medical professional for proper evaluation and potential referral to a specialist. Now let's talk about phlebitis. If you encounter phlebitis as a complication after an IV insertion, you withdraw the needle immediately and also look for signs of infection, such as redness, swelling, or increased pain. If these signs are present, you consult with your medical professional for prescribed antibiotics to be given to the patient. In all of this, you try to calm the patient down. You talk to the patient in a polite manner. You educate the patient about the potential complications, and even as they have happened, you still talk to them and reassure them of their safety. Also note the importance of reporting any concerns. By following this structured approach, we can minimize the risk of complications during an IV insertion, even in patients with difficult veins. I thank you all for watching. Like and share the video for me, and then subscribe if you've not done so yet. There is Time with Nurse Joyce Lane. I'll see you in my next video.